Good afternoon, everyone, here as well as online. Welcome to the White House as we celebrate the life-changing power of recovery and the millions of Americans who are in recovery today. And when I say millions of Americans, I mean tens of millions. There are more than 20 million Americans in recovery, and to us, all of us here, that's 20 million stories of courage, of bravery, and 20 million examples of what it will take to bring our country out of this heartbreaking epidemic and build a recovery-ready nation. And I'm here to say on behalf of President Biden that with your help, we're going to chart our way out of this epidemic. We're going to make sure that every person struggling with addiction finds a path to recovery, and that every person in recovery has a path to sustaining it. We all know the challenge that we face today. An American dies from a drug overdose or poisoning every 5 minutes of every hour of every day of the year. And 3 out of 4 of those deaths are because of opioids like fentanyl. Now, we know that that's a son or a daughter, that's a brother or a sister, friend or a neighbor, who are not going to be at the dinner table. They're not going to be around for holidays and miss those life's important events. That's 110,000 people every year that will not have that chance to have the joy of recovery in the way that we all do right here in this room. Now, if that doesn't break your heart, I don't know what will. So this crisis is tearing our communities apart. It cuts across every geographic, demographic, and economic boundary. And that's why this issue is personal to the president and is personal to me. In fact, President Biden has proclaimed September as National Recovery Month. I'm going to quote an excerpt out of his proclamation. Quote, "We want everyone to know that they are never alone. As a nation working together, we can make recovery real for more Americans," close quote. Now, as a doctor who's seen many patients enter recovery, I know that there's more than one path to get there. Every patient of mine, like everyone here today, had their own personal path journey to recovery, which is why under my leadership, this administration is working to ensure that every possible pathway to recovery is open for every possible person with addiction. Now, from flooding streets with naloxone, the life-saving drug, to making sure that we get treatment easier than ever, to preventing youth substance use from ever beginning, and leading to a whole-of-government effort to building a recovery-ready nation. And that's why I'm so proud that SAMHSA has now stood up an Office of Recovery. It's also why we're focused on efforts like expanding the addiction workforce through peer recovery specialists. Now, you know, and I know that there's a lot that goes into maintaining recovery. It is more than treatment. It's about having safe and supportive communities to live. It's about childcare, transportation, food security, education, economic opportunity, employment, and so much more. And we know that around the country, half of the country's people in recovery receive their health coverage from employers. And as the president likes to say, a job is more than a paycheck. It's about dignity. It's about respect. It's about being able to look your kid in the eye and say, everything will be okay. In West Virginia a while back, someone in recovery told me that having a job makes all the difference in the world. So we're gearing up today to undertake a multi-pronged effort to support recovery-ready workplaces. President Biden has made getting Americans back to work a top priority. He's made historic investments through the bipartisan infrastructure law that's creating good-paying jobs that bolster our middle class. Like he says, we're growing the economy from middle out and bottom up. As more people are coming back on the job, ONDCP is working to ensure that employers are ready to welcome and support people in recovery. And that's why the Department of Labor, we launched with them Online Recovery Ready Workplace Hub. This is an online hub tailor-made to help businesses and employers build recovery-ready workplaces. It includes resources that make business case, the business case for supporting people in recovery at the workplace, and tools to help businesses get started and succeed. And soon, very soon, it'll include additional resources. I'll give businesses even more tools to make it even easier to get started. Now, I don't have to tell you how much this work matters. I see it every day, every single day, in the faces of people in recovery as I travel across the country. They are our most passionate, hardest working team members ever. These are our closest and genuine friends. And you might wonder, how do I know that? Well, this is because there's so many people in recovery that are here on staff at the White House and throughout government. And this administration is doing everything we can to make sure that every person struggling with addiction has a path to recovery. And then working together, we're getting results. Overdose deaths have flattened in 22, with an additional saving of 19,000 lives. Today, those people have a shot at recovery. But we can't stop. We can't stop until we drive these overdose numbers down and provide support for the people that they need to get into recovery. Now, beating this crisis is going to include all of us, and we all have to do our part to make this a recovery-ready nation. Your story of hope can inspire people to start their recovery journey. You can be the reason that their seat at the dinner table is filled. And in doing so, you can help us beat this crisis. So I want to thank you for stepping up to be a part of the solution. Thank you today for joining the Celebration of Recovery. We do have a great program today. I want to thank Senator Jeanne Shaheen, Congressman Paul Tonko, Assistant Secretary Delphin Ritten for SAMHSA, and a number of CEOs and young people in recovery and others that are taking part today. Now, let me invite the next speaker to the podium. Senator Shaheen has long been a leader in Congress for addressing the opioid crisis, which has hit New Hampshire hard, just like it hit my home state of West Virginia. And we're thankful to have such a strong champion for treatment and recovery joining us today. Whether she's working to expand access to naloxone, make treatment easier to get, to help build a national infrastructure for recovery support services, Senator Shaheen is a true friend of this movement. And I've seen this passion myself when I traveled with her to Manchester just recently last year. So please welcome me in joining Senator Jeanne Shaheen.
Good afternoon. Thank you very much, Dr. Gupta. Thank you for all the work that you do. It's so nice to see everyone here. I met your new head of the Office of Recovery in the security line. I can tell you he's excited and ready to go. So, a deputy, I'm sorry, you're right. But see, I just gave you a promotion. Let me, because I don't know everybody in the room, let me just get a sense of who everyone is here. I know sort of the categories of people who are here, but how many students do we have here? And how many people who are running or working in recovery programs? I know there's some overlap here. How many CEOs and staff from companies that are working with your employees? And I know we have a few policymakers. Thank you. Did I miss anybody?
Union presidents.
I put you in the CEO category. Come on. Thank you all very much for being here. I'm so pleased to be invited to join you today. And as Dr. Gupta said, sadly, New Hampshire, like West Virginia, was one of the states hit the earliest by the opioid epidemic. I think it's fair to say that everybody I know in New Hampshire knows someone or a family who has been affected by substance misuse. Recently, I visited a women-owned and operated recovery support facility, and actually, facility is the wrong word because it's really a home, called Hope on Haven Hill, which is in Rochester, New Hampshire. It's about a half an hour from where I live in the state, and so I've been able to see that it's one of the places in our state that's been very hard hit. But what Hope on Haven Hill does is support women seeking recovery and women with small children or pregnant women. And they provide support for the women, and I use the term support deliberately, as all of you know, because they offer a range of substance use disorder treatment and mental health services. And the women who are running this facility realized very early on that no amount of medication-assisted treatment could cure unstable housing, abusive households, or hunger. And they realized that real recovery depends on feeling control over one's choices and having some agency over our own lives. So they took it upon themselves to treat their patients as whole individuals, not just to treat the illness. Hope on Haven Hill now offers housing to every woman and their dependent who needs it, who's part of their program. They offer transportation to and from appointments. They bring outside providers into the facility so that women receiving treatment can get multiple medical appointments in the same day. They provide domestic violence services and counseling. They offer food assistance, career training. They even have a store where women can choose their own clothes instead of receiving donations. And it's these small but very important choices that are made possible by that amazing team at Hope on Haven Hill and other recovery programs like it that really lead to long-term stability and long-term recovery. You all in this room know this. But we have to be holistic about how we handle recovery. And so I'm pleased that's why I wanted to know who everybody is, because today's discussion includes not just those in recovery and providers, but it includes employers. No two patients are the same. Each need and deserve unique support that goes well beyond the disease of addiction. And that really leads me to the last point that I want to make, because what we need at the federal, state, and local levels, and in terms of support for recovery services and for treatment, is flexibility. Flexibility to meet the needs of patients, to meet the needs of communities, and to address the evolving crisis. Now, in New Hampshire, we made some real progress before COVID, and we were seeing rates of substance misuse decline. We were seeing overdoses stabilize, but of course, the pandemic changed that, and we saw the numbers begin to go back up. But that's why the State Opioid Response Grant Program, the work of ONDCP, so many of the efforts that are being done by the administration are so critical. We know through the state opioid response grants in New Hampshire, we've been able to provide naloxone or Narcan to every EMT, police officer, firefighter, libraries, community workers, and that has made a huge difference. The overdose death rates are beginning to stabilize again, but as we know, those overdose deaths aren't the answer. Getting those numbers down are critical, but we've also got to deal with the underlying recovery, and that's what this discussion today is all about. We also realize that, at least in New Hampshire, we were seeing not just opioids, fentanyl, obviously, but also a rise in methamphetamine, a rise in cocaine, and the programs that we had tried to put in place in Washington weren't flexible enough to address that. So we've got to be able to make changes a lot faster than we've been able to in the past. Obviously, we've adapted the programs, but there's more work that needs to be done. And of course, housing, as we all know, is so critical. And right now we have a housing crisis in this country. It's particularly acute in New Hampshire. And unfortunately, HUD's program to try and help with recovery housing receives only $30 million each year, and only half of the states are eligible each year. So it's past time we lift up those vital programs, and that's what I've been working on in the Senate, and so many of my colleagues have been working on, and I'm pleased that this is an issue that has bipartisan support in Congress. We know that to be successful, we've got to work together, and hopefully we can work together to keep the government open so that what you're depending on is going to continue to be there. But last, just let me comment, because one of the other things we've seen in New Hampshire is a rise in xylazine, which is being used now to mix with pills and fentanyl. And as we know, Narcan doesn't work on xylazine. And while NIH and the Office of Dr. Valco and the office that's researching how do we address substance issues is doing great work, they don't have an answer yet for xylazine. And what we've seen in New Hampshire is that mortality rates from xylazine have risen 3 times in the last year. So it's a challenge that we've got to continue to address. And I am so pleased that we have an administration that understands that we've all got to work together, that there is not one silver bullet solution, and especially appreciate Dr. Gupta and the work that you are doing, the work that SAMHSA is doing to ensure that we do work together to address this scourge and make a difference for the people of this country. So let me now turn it over to Dr. Delphin Rittman, and thank you for what you're doing in your role at SAMHSA.
So good afternoon, everyone. I have to say it is such a pleasure to be here. I want to thank Dr. Gupta and his team for convening us and for the work that you do every day. We so appreciate the partnership and just your commitment and leadership to addressing overdose and partnership through many of the different recovery events this month as well. Senator Sheen, thank you for being here as well. I understand Congressman Tonko will be arriving as well, and so just such a pleasure to have a gathering of so many familiar faces and friends around this really, really important conversation. I'm grateful to moderate this panel. Happy Recovery Month. I do want to say that. Happy Recovery Month. It's just an honor to be able to celebrate the tens and millions of Americans in recovery across the country. I just came from a 3-day event, downtown at the Mayflower, Mobilize Recovery, and it's just wonderful to see the energy of everyone gathered there, really celebrating recovery together. And we have many individuals from that meeting here with us today as well. I'm grateful to the students that are with us, and so before I begin the panel, I do want to say a special thank you and just to acknowledge Zakaya and Michael, who are with us from the First Recovery High School in Virginia. They're here from Chesterfield Academy, or Chesterfield Recovery Academy, and will be on the panel. I'd also like to acknowledge just the wonderful other students that are here as well, both in person and viewing online. So appreciate your presence and really look forward to connecting afterwards as well. And thank you everyone else who is with us. We know that recovery is often one day at a time. You know, what we hear, and certainly what we've been hearing, it's one day at a time. It's one step at a time. And as Dr. Gupta mentioned, through the various areas in which recovery can happen and people experience recovery at the community level, that recovery is often very much rooted in community. We hear often that recovery happens through and in community. At SAMHSA, we fund states, communities, tribes, territories on a broad range of programs to address mental health, prevention, treatment, harm reduction, and recovery services and supports, geared really to meet individuals where they are and to combat and overcome the disease of addiction, but also to help people experience recovery and address mental health challenges as well. Senator Sheen mentioned our state opioid response grant, and one of the things we're working on now is around saturating communities with naloxone to ensure that if an individual is struggling, there is naloxone available to be able to address them in that moment of need. And so that's just one example of some of the programs that we're funding. We also fund xylazine test strips as well that can now be used. And Senator Sheen, I know you mentioned xylazine test strips as well. And so just two examples, again, of some of our programs. We know that, recovery can be challenging, and what we often hear is that, but it is so important to celebrate recovery, particularly this month. And it's so important to celebrate the communities, the schools, the workplaces that are demonstrating recovery-friendly practices. We know that place and space matters, and it's important for individuals to feel welcomed, to feel supported, for their stories to be honored. And we very much see that within recovery high schools or recovery colleges, which thankfully we see bubbling up all over the country. And so that's what our first panel is. We're going to talk about recovery high schools and some of the just amazing work that's happening there. And so grateful that we have students with us to share some of their experiences and administrators to share some of their experiences at Recovery High School. So we're going to shift gears. I'm going to now introduce our panel. So I'll ask our panelists to come on up. I'm going to come over here with you. So with us we have, I'll wait till everyone. Okay. I'm going to come over here with them. So I would like to welcome our panelists. We have Mr. Michael Dierschlag, who is the director of the Association of Recovery Schools, and Michael is on the far end there. Yep. We also have Mr. Justin Savoy, who is the principal of Chesterfield Academy, again, the first recovery high school in Virginia. We have Zakiah Kearney, who is a student at Chesterfield Academy. And we have Michael Spain, who also is a Chesterfield Academy student. So this is what we're going to do. I have 5 questions, and I'm going to ask each of you a question, and then we'll have time at the end where there's a question for everybody. So we'll start. So Mr. Savoy, how do recovery high schools address the needs of students struggling with substance use disorder?
Well, first I would say that recovery schools give our students hope. A lot of times they're coming from circumstances that they are surrounded by negative influences and unfortunately some adults who continuously judge them by their previous histories. Recovery schools give them the opportunity to be in an atmosphere that is non-judgmental. You can provide trust and build a sense of community because they're all there for the same reasons. When it comes to recovery academies, just a famous plug, for Chesterfield Recovery Academy, we have a nice blend of academic and clinical staff. So at our school, our clinical staff led by Melissa Mariner, Kara Jones, and Kara Wilson and Anna Jones, to help our students maintain and sustain their sobriety. While our academic team led by Ms. Omnistone, Eric, Snyder, Don Snyder, and Darian K, they help our students get back on track for graduation, work on their post-secondary skills and goals. So we do the holistic approach for our students to make sure that when they transition back to the community, they have an overall approach of how to sustain their sobriety, but also be a functioning member of society.
Fantastic. Thank you so much. Thank you. And I love that you mentioned hope. You know, hope is such a critical part of the recovery process. So now we're going to go to Michael and Zakiah. So you're students at a new recovery high school. How did you hear about Chesterfield Academy, and why did you choose a recovery high school?
I had multiple occasions where I got in trouble at different schools that I attended, and I kept getting kicked out and couldn't find the right place to go. And eventually I was in the school board's office, and I found my way to a brochure to the Recovery Academy, and that's when I started my journey.
Thank you. Thank you so much. Thank you. And so Zakiah, so the question was, how did you hear about Chesterfield Academy, and why did you choose a recovery high school?
I heard about it because my mom showed me it one time because I didn't like the school I was going to, and it wasn't a good environment for me. And I never even went, and I was on the verge of just like leaving. So she just showed me it, and I didn't want to go at first, but I decided to because it was like the best thing for me, and I ended up really liking it.
Wonderful. Wonderful. Yeah. Thank you so much. And so, Mr. Dierschlag, you operate one of the most well-known recovery high schools in the country. How does the community engage with and support peers enjoying sober education, or PEAS?
In a lot of ways, you know, this January we'll be celebrating our 35th year in existence, and it's amazing to be a part of that. When I became the director in 2007, and I taught there for 11 years prior, I knew community engagement was really important. First of all, we're part of a larger school district, Minnesota Transitions Charter School, that supports our mission and supports what we do and really understands why we exist and the importance of serving the youth that we serve and the families that we serve. And so I think that's the first community engagement, is just being part of a supportive school district. I'm very active in terms of getting out to the different treatment providers and other recovery organizations to make sure that they continue to know who we are and how we serve the youth. And they also in turn show up at our events. And then being very active in the community-based recovery support. And so, you know, this coming up Saturday, we're having a pancake breakfast, and not that you all are going to come, but you're more than welcome. And it's amazing just to see the community support show up from all over the place, all over Minnesota. So, and then also the legislature. You know, we are there, and they get to know each other. And what's interesting, so I'm a person in long-term recovery, and so sometimes the fear shows up like, oh, can't go up and introduce myself, or they've met me before, but just being able to go up there and saying, hi, my name is Mike Dierschlag, and overcoming that, and just being out there and being in the community builds that support over years and years.
Thank you. Thank you. Yeah, and it's wonderful to hear just the range of community support that the school has. So we're going to go back to Michael and Zakiah. So what advice do you have for friends who are worried about drugs or alcohol, who are worried about use? What advice would you give to one of your friends? Yeah, you can go.
I would tell them, I don't know, as a teenager, it's kind of inevitable that somebody might dabble in drugs and alcohol, but it's like, if it's to the point where it's an addiction, I would definitely try to help them. It's not easy at all, and people need support system. And when I was going through it, I really didn't have that. So it would be nice for somebody who's doing that to have somebody there for them. So I would just be there for them.
Yeah.
That's all I can really do.
Thank you. Thank you. Yeah. You know, and I also had a quick comment. You know, that's wonderful. I love what you said, that you will just be there for them. And sometimes just that presence, just being there in a compassionate way. So thank you for that. Michael, how about you?
I would suggest being clean yourself. There's a lot of times where in my recovery it was impossible to find anybody that even had days put together, and that just made it all feel impossible. So if you want to help somebody else, just show them that it's possible.
That's wonderful. Yeah. 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 Thank you for that. I mean, you're talking about role modeling, just role modeling and giving them hope that, being clean yourselves, and they're seeing that that is possible. So appreciate your sharing. Yeah. And so now we're going to go to Mr. Savoy and Durslag. We know that not every student would benefit from a recovery school, or not every student has the opportunity to attend one, excuse me. We know not every student has the opportunity to attend one. What do you recommend at all schools, not just recovery schools, who have members of students who may be struggling with substances? So it may not be a recovery high school, but there may be students that are struggling. So what would you recommend for that type of school? Yeah, we'll start with Justin, and then we'll go down. Yeah.
First, I would say that they need to acknowledge the fact that there are students in their school building that actually are battling addiction, erasing the stigma behind it and accepting the fact that they need help. Partnering with the community partners, those who do mental health and substance abuse treatment, even faith-based organizations, can assist them in delivering the message. You take it from there and you talk to your elected officials. You talk about legislation to address the need. There are students who have ease of access through social media, and that needs to be addressed, and even the penalties for those who are caught selling to youth, that needs to be addressed as well. And it's great that we live in a community where mental health is coming to the forefront. However, when it's addressed, it's always mainly towards adults, and a lot of resources need to go towards children. The children are going to be the future policymakers. So why not address it now and have a generation that will now govern and actually pass legislation on the empathetic side that understands sobriety and addiction.
Yeah. Thank you. Thank you. Yes, I mean, we know early intervention is so important, so important.
I kind of echo some of the things that Justin mentioned, and one is to overcome the stigma. I know that a lot of schools don't want to acknowledge because they think it might look bad upon them, but we know that in all communities. The other is to actually have people who are in the schools who have been trained and experts in substance use and substance misuse. I think we still kind of operate in a just say no era where when young people come to them and they're trying to make changes and do something different, they'll say, oh, don't use and don't hang out with those old friends anymore. And we just know that that's not going to be a recipe for success. And so to have people actually in the schools that have more training and knowledge, and also to provide opportunities for youth to talk about substance use in a non-judgmental way. We talk about criminalizing this disease, and I think that starts in the schools where if someone is using and is caught in using, it's a zero tolerance and they're excluded, they're shamed, and if we can build environments where people are actually able to openly talk about their use and set goals, through motivational interviewing and kind of help them move through that and to create their own pathways, for lack of better words, in the schools, I think we would be a lot better off. And then within the schools, create safe space for those who don't want to use and supportive environments to help with that.
Yeah. Thank you. Yeah. Yeah, such important points. I mean, the piece around stigma, we know it's so important to have those conversations to be able to address stigma, and then to have those spaces that are safe for students that don't want to use. So thank you for sharing that. So our last question is for each of the panelists. And we know that, this month is Recovery Month. Part of what we do with Recovery Month, we know, is we just celebrate the successes of individuals in recovery. So can you each share something that you're proud of to have accomplished on your recovery journey?
Ever since I first started to attend Chesterfield Recovery Academy, I always wanted to pursue a career in the military, but passing a drug test was never an option. And I viewed it as impossible and took it to terms and almost accepted it that it might just not ever be available for someone like me. I spent the time, I put in the work, and now I ship off June 31st, 2024.
That is awesome, Michael. Feel the love in the room, and I love what you said. You know, I put in the time, I took the time, I did the work, and congratulations. Thank you so much. So yes, go ahead. So the question is, can you share something that you're really proud of that you've accomplished in recovery?
When I went to regular school, I had no aspirations, no desires, no nothing. I was just trying to get in and get out. They didn't even know what I was going to do when I got out, but I didn't really care. But when I came to the school I'm at now, they actually care. They were helping me decide what I wanted to do. And my teacher, Miss Stone, she helped me a lot and figure out what I do want to do now. So I'm planning on going to law school after I graduate here.
That's fantastic. Yeah, congratulations. Yes.
Okay. Even though I'm not on a personal journey to recovery, I will just say that our biggest accomplishment would be the program. We started last year, so we are officially in our second year. We've had a great impact on the community, getting the word out. We've had 4 graduates, 2 term and 2 summer graduates, 1 graduate a year early. I'm extremely proud of our students and the journeys that they've made, and that we made it here to the White House. And we are just here in Virginia to represent the state and showing that how do you address adolescent drug use and how do you build a community?
The biggest accomplishment, well, being here. I mean, seriously, and I mean that in all sincerity. I mean, I'm in the White House. I get to be, I get to be the director of the longest running recovery school, and I've been there for 28 years. And I get to see people completely change their lives around and have their families come back together. And so I think in all that time, that's probably my biggest accomplishment in recovery, is just to be, in a lack of better words, to be of service and be a part of something that's much bigger than myself and help other people.
Thank you, thank you. So such inspiration, and so just appreciate each of you sharing your experiences and your stories with us. Why don't we do this? I think we've got a bit of time. I can do, oh good, okay, so I can take some liberties. We have a little bit of time. Why don't we end? Can you just share 1 or 2 things that, that you would want people to know about recovery?
If I had to choose about something that I wish that I knew, I wish I knew earlier that I wasn't crazy, that I wasn't the only one with this problem, and that I wasn't the only one that had to deal with what I deal with. It's easy to think that you stand alone in the fight that you take, but you don't. You just have to find your support, work from there, use it to your advantage, and succeed.
Fantastic. Thank you. Thank you so much. Yeah. So the question is, like, one thing that you'd like to share about recovery. And thank you so much, Michael, for your sharing.
I'm going to jump in because everybody's sitting there waiting to push the button, so are wondering. I would say that young people can recover.
Yes.
And there might be some ups and downs, but young people can recover. And not only can they recover, but they have a ton of fun doing it. Life is not over when they put down the substance use. It actually sometimes begins, and we just have a ton of fun doing it.
Yes. Sure.
I think one thing that I thought, I was beating myself up about it a lot, was that I thought it was going to be easier. And whenever you relapse or something, you think that it's over, and it sucks. But I definitely would like people to know that just because you relapse doesn't mean you're a failure. You know, you go through things, and as long as like you're still a person at the end of the day. So you make mistakes, but it's not over just because something bad happens. It's a part of the recovery, really. So that's.
Thank you. Thank you.
I would just share that recovery is a journey. Every day is going to be something different. It's not always going to be rainbows and sunshine. Some days it's going to rain. So put on your coat. It's a personal journey to every day that you're going to have to walk through life. Sometimes you're going to have to explain yourself, and sometimes people just understand you. You'll have support, and sometimes you have to be your own superhero. But it's your journey and your journey alone in this world, but make it worth it. Everyone has a life to live. Everyone deserves to have a prosperous life. And that just because you're in recovery does not mean you're anybody that's any different. You deserve just as anything else as anybody else on this planet.
You know, I am just so grateful for this panel and for the sharing that each of you did. I mean, such profound sort of wisdom and points of just, you know, nuggets of wisdom that you've shared with us. And so thank you so much for being here with us. Thank you for sharing your experiences. And all the best to you as you continue on with your really exciting journeys that are coming up, with the work that's continuing at Chesterfield Academy, you know, Zakiya, with your continuing on to law school, with your, you know, soon deploying or soon going into the service, Michael, and for the amazing work that you're doing, Mr. Savoy, as well. So thank you so much for being with us. Just one last comment. You know, one of the themes of this Recovery Month is that recovery is real and recovery is possible. And you all have absolutely shown that as examples with just the stories you've shared and the work that you do every day. So thank you so much. All right. And we are going to transition to the next panel. So.
Well, that was such a fantastic panel. You know, did we understand? Let's give another round of applause to the panel and Dr. Ritten. You know, when I see two young people, one talked about what are you going to do? One said to be there, and the other said walk the talk. That's what we want out of the future, but we also want from this room coming out today is that type of commitment. And then the futures we talk about. It is obviously always inspirational to hear the stories and experiences and the stigma-breaking actions, how we help each other. We heard today about helping each other, lifting the other one up. So thank you again. Now we're going to talk about something really important because whether we know Michael is going to go to defend our country and Zakiya is going to hopefully defend the Constitution. So, but you're all going to need a job at the end of the day. And we're going to talk about why, from the leaders in business, this is so important, because we need to make sure that we're supporting recovery in workplace. So earlier we talked about the importance of employment to maintaining recovery. I think it's probably the most important piece, and how vital it is for employers to support. So today we've got some great leadership here joining us. So let me just introduce the panel and we'll get started. So we have Liz Porter, President of Leidos Health Group. We have Greg Ashlock, CEO of iHeartMedia Multi-Platform Group. We have Ben Garth Waite, CEO of Force Marsh, and then Sarah Nelson, President of the Association of Flight Attendants. Thank you for being here today. So the way we're going to do this is, you obviously want to know what the business is and what they do, and then how you are supporting recovery. You know, I was just in Indiana last week, and I ended up in a rural town of Frankfort, Indiana, a town of 16,000 people. And we did a roundtable, and we saw 3 employers bring each one with them an employee in recovery, and we had a conversation. It was amazing. 16,000 people town, 3, some of them are major national employers, and do that. So let's start with you, Liz. Your company was one of the first ones to step up towards obviously addressing the opioid crisis, and got a lot of attention, and called on other CEOs to take action. What kind of things did your company do to respond to the crisis, and obviously what does your company do in the beginning of it?
Thank you very much, and that was a very impressive panel. So when we talk about jobs for the future, these are bright, talented individuals that will have bright, talented futures. So very excited about this. You mentioned, Dr. Gupta, that it's personal. For Leidos, it started as a personal journey. There was an employee who had tragically had a son die from an opioid overdose, and he reached out to our then CEO, and this was in 2017. And candidly, in 2017, we really didn't know much about the opioid crisis. And it was a journey that we began on. And that journey really took us to say, this is something we wanted to stand behind and understand and help address. And so we actually mentioned this and brought out this initiative to our employees. And it was at that time that we realized the groundswell of all the employees, their family members, their colleagues that were suffering some of these same situations. And so really brought it to the forefront, and we knew we wanted to do something about it. And so thinking about it now, I'd like to think we're a little bit better versed in understanding on the epidemic and some of the overall challenges, and we know that that's a workforce challenge. When we think about a company like Leidos, we really do rely on the brain power of very talented people, and our CEO will talk about our talented people. So them being able to bring their full selves to work and to be able to be there and be present is super important to us. And so one of the things that became clear as we were working through this was that one company, Leidos, could not do this alone. And so we realized it was going to take a coalition. And so our CEO started with a CEO pledge and started reaching out to other companies, and then partnered with the Milken Institute for Public Health. And through that, we were able to bring on over 200 other companies, a little over 200 companies, whose CEOs have also committed. And they are really making a difference in their workplaces. And so part of it at that time was really thinking about how you would bring this challenge forward and help to reduce, we talked about the stigmas, help reduce the stigma around the situation. And I think part of that is what started us on our journey to become recovery supportive of workplace.
Thank you. And for young people, perhaps, maybe Liz, you might just briefly mention what does the company do, so they're for their future jobs as well.
Yeah, we want you all. So Leidos does a lot of things. Our mission statement is to make the world safer, healthier, and more efficient through science, engineering, and technology. So at the heart of it, we are a science and engineering technology company. We build a lot of solutions. I know we have some representation from flight attendants. Most people know our company because of the body scanners at the airports. But we do a lot of technology. We're really at the heart of it is solving customers' missions. So whether it's the Department of Defense and the military service, we do a lot of different things. But as a health group, we do specifically in the health space.
Thank you for sharing that. And speaking of employers, of course, having a job, Greg, is so important, as we all know, as a critical part of sustaining recovery. And share with us both, obviously, iHeartMedia's work, but also the critical platforms that you're using to encourage employers to support recovery in the workplace.
Sure. I will agree with Liz. It sounds like you guys already have your futures planned, but I was thinking based on your poise, there may be a podcasting or broadcasting.
We've got more. We've got 2 rows right there behind them.
Thank you for, first of all, for assembling this panel. We're grateful to be part of the recovery efforts. And it's important because it's a topic that everyone should be discussing. And it's the right thing to do, and we can all in some way play a role in helping. Not to mention the fact that we're also licensed by the FCC to serve our communities. And this is really important to the communities, and we take that responsibility seriously. To your question about how we can use our platforms, I think first and foremost, we have reach and we have scale. We own and operate in 160 markets. We reach 276 million people a month, which is 9 in 10 Americans, including employers. And we can take that scale, and we can take that reach and message and help. I think where our lane is as a media company, and other media companies too, where our lane is how can we use that scale and reach to reduce stigma around substance use disorders and recovery. And we can do that both nationally, through national media, or we can jump into the community, which is so important. I heard the word community a couple of times from the speakers that came up. So whether you're in Tulsa or you're in Bakersfield or Seattle, that we can actually have that conversation, whether it's through our broadcast hosts, whether it's through voices that we have with celebrities or influencers, or whether it's through podcasts, we can have that conversation to help reduce stigma, which is, for whatever reason, and a couple of people have touched on it, this is a topic that has been kept in the background. It's been in the shadows. And it's important for employers, but also for media companies to step up and make sure that the topic gets to the forefront, that it's a topic that people are comfortable having a conversation about. Dr. Gupta, you started by saying that every 5 minutes that someone dies from an overdose. That means just during this panel, 5 more people have died. And so if that's not a reason to get behind it, I don't know what is, right? And so practically what it means is we'll have campaigns, like right now we have a campaign on the air with Influencer Voice from lived experiences from people like Macklemore and Melissa Etheridge that are sending out messages of hope and help and recovery. Or we are partnering with Mobilize Recovery to make sure that we promote and get behind the recovery movement. At the end of the day, I think when somebody's blessed with a kind of scale or reach, that you have a responsibility. And so what we want to do is use that reach to deliver a human touch. It's one thing to use an algorithm to send out, messaging or whatever else, but it's another thing to have a human voice and to have a human touch to make an impact and make sure that we're heard with every, income level, with every demographic, with every ethnicity, and with every community, because everybody's impacted. And so we see that, and we're committed to playing a role.
That is so important, because when we talk about, this is everybody's problem, and it's also all of us are going to bring solutions to it. So
That's right.
As a business, what you do has such an impact, and I want to thank you. Speaking of business, of course, Ben from Forest Marsh, just want to ask, you're focused on supporting recovery in the workplace. If you want to share a bit about both the company, but also why, and what does that look like in practice?
Okay, there's a few questions in there. So I'll start. I'm Ben. I'm an employee and leader at Forest Marsh Group. And Forest Marsh, I'm representing the 500 or so of us. And together we take on some of the biggest challenges facing this country. And that includes promoting public health, building communities that are more sustainable and resilient, and strengthening our institutions so that they're inclusive and effective for all of us. And substance use disorder and recovery kind of underlie all of those, they intersect with all of those. And so we've been working on that issue on a variety of angles for a lot of years, as have a lot of people in this room and beyond. But we're a research-first company, so that means before we do anything, before we act, we listen. We listen to those with lived experience, we listen to the data, and it takes us pretty quickly in this space to recovery, where historically there's been a disproportionate amount of attention and funding and resourcing. And, frankly, it takes, I think, to address that gap, it takes academia, government, nonprofit, associations, business. We all have an important role to play. So it's a pretty beautiful thing that we're sitting in this room this historic room talking about recovery and Recovery Month. So just thank you. Thank you for putting on it. So that's a beautiful thing in my book. Now, okay, you asked me another question about workforce. Sorry, I could talk all day on this. I'm gonna edit myself, okay? but why workforce? So the fact is, if you follow the data even further, 71% of Americans look to their employers for health benefits, right? And so we have a huge responsibility and an opportunity to shape lives and alter lives by the way we show up or don't for those employees when they need us.
I mean, you heard that right, 71%. And if you think about 46 million Americans with substance use disorder, you think about 20+ million Americans in recovery. I mean, talk about adults across this country that recovery touches and it has the potential to touch. It is unbelievable, quite a bit. And that becomes important not just only for obviously our businesses, our research groups, but also our associations and others who are working, because it's that leadership that is going to take all of us together truly. So from the Association of Flight Attendants, Sarah, let me ask you this, and then from a union perspective, and all of the conversations that happen amongst that, what makes substance use treatment as well as recovery a priority for the union as opposed to a million other things that go on?
Well, thank you so much, Dr. Gupta, and it is an extraordinary honor to be here talking about this. And I'm sitting next to Ben and feeling his energy about the fact that we get to talk about recovery and addiction and talk about it in a way that is about problem solving and lifting people up rather than shame and hiding these issues. So that is really what happened with our union. Is our union formed a program called our AFA EAP, Employee Assistance Program and Professional Standards. And we work in an environment that we're in safety critical jobs. And we really found that in order to support our members, we needed to create this program. So we started advocating for FADAP, for the Flight Attendant Drug and Alcohol Program, which its tagline is, recovery is not a hard landing, it's a journey. And we advocated for this starting in 2006 because we recognized the need for it as we were taking in the issues of troubled flight attendants who were losing their jobs, not getting the support that they needed. And just to put a fine point on it, we travel to every corner of the earth. We travel with people on our planes in these metal tubes who are often going for celebrations, or they're going because they're grieving, or we're taking men and women to war or bringing them home again. That's our favorite part, by the way. People are there for all these different reasons, and we have alcohol that we're serving, and it's a huge part of our training in both how you make sure that people have a good time, but also meter that out and make sure that people stay safe. But then we're staying in hotels where there's a hotel bar there, and our social system is about the crews hanging out together on these layovers because we're not integrated into the rest of society. And you never know who you're going to be flying with. So this can be quite lonely if you were someone who is struggling or someone who is in recovery. And we recognized that we needed to create a specific program for flight attendants to be able to respond to that. So we have a wellness app, we have routine virtual trainings, we have monthly educational newsletters to labor leaders and to members to bring this out into the open and help people understand. We have a 3-day annual conference for flight attendants and management to come together to talk about this, about solutions. We have an informal website, or an information website, called FADAP.org that people can check out. But we did this because there were no solutions there for flight attendants and for our members, and we wanted to create solutions. So this is an early intervention program in education, and it's education for someone like me who is an ally but wouldn't know how to be an ally and would think without this program that if I say anything, if I interject in any way, that's someone's job on the line. And they're losing that, and they're losing their ability to care for their families. So this is a safety initiative program that is for both allies and people who are at high risk or struggling with addiction.
That's so important. I mean, thank you for saying that. because you brought in a few things, which is, first of all, the fear, the stigma, and the fear of really losing your employment. Another one is that there are needs and requirements of certain professions where this is not very, it's something that we need to be proactive thinking about, and it's a safety issue at some point. So, as you mentioned, Liz, talking with CEOs, having about 200 of them signed up to look at this, how do you go about that, and how do we accelerate? We talked about the urgency of this issue, the urgency of getting more people into recovery, but also the employers, we want to feel like have also a sense of urgency.
Thank you. Certainly, leadership starts from the top. And so as executives, we have the ability and the responsibility to set the culture so that we can remove that stigma, so that we can create that area and safe space for the dialogues to begin and to have the dialogue and to open up that discussion. But it's not something you have to do alone. You're hearing from multiple companies and organizations who have started on this journey. So if I went back to 2017, if there had been others to help us, that would have been great to talk to. But find those organizations that have been on this journey, that have those lessons to share and the best practices to share. Because we've learned some of those policies and benefits that we need to have in place, the partnerships we've even made with the community that really help to spread the word, because we all know we tend to work in the communities that we live in, and so those are the individuals that can help share that message and share that story, and it will move it along. So that collaboration is really key. And I know it might seem a little daunting, but having that genuine commitment and sticking to it will really help move everyone forward a little bit faster.
Thank you for that. Thank you. The commitment is so important, but at the same time, I think one of the things that happens is, when we are engaging people both in their recovery journey, but others who are working as both influencers as well as on platforms to promote messages, definitely want to sort of see, Greg, what your thoughts are about where this leads to from your side of the business, from celebrity engagement to platform use for others as we move forward, because whether it's inclusion of more CEOs or inclusion of further platforms, I think it's going to be something really important for the American people to understand that this is possible.
Yeah, I think at the end of the day, regardless of the platform, whether it's broadcast or podcast or digital stream or whatever you're using, social media, that at the end of the day, the goal would be, how do we normalize the topic of SUD and recovery? Through conversation. And that conversation can take place in a lot of different ways. It can be through, as I shared earlier, through voiced influencers like Macklemore and Melissa Etheridge right now that are on the air. Or it could be through local brands that I talked about around the country and the on-air host or the podcast host, or because there's a trust that already exists with these hosts. And part of, I think, the message getting through is if you're hearing the message from somebody you trust. It's never going to be, when Zakiya and Michael were talking, they were talking about, if I had somebody there. Like, that personal friend is the best form of trust that can help you through it. Yeah. But what media can do is, if there is this trust that exists, and this may be hard to believe, but 73% of our listeners on broadcast hosts, their listeners to their favorite host, consider them a friend because they spend an hour a day with them. Right. And so if they're delivering a message that results in a lean-in listening, and it's like a message that will break through because there is a trusted voice talking to you about it, then that's the right time for us, because we want to reach people whenever they're ready for the message. And I think from what I've heard, even from listening, is like, you may not be ready for the message, and there's a moment in time when it's like, I'm now open to hear this. Whether it's because I've hit rock bottom or because I've talked to a friend or because of whatever else, we want to make sure that we're in their ear, and any media company should be like, how can I reach them then? So whether it's in the car on the way to work or coming back from a friend's house, or whether it's in your kitchen on a smart speaker, or whether it's walking the dog with your headphones on, listening on an app. It's like reaching them at the right time. And if you have that lean-in listening, then that's probably the right time that then this is a place we can direct you for help. Mm-hmm. If you're talking to somebody that is struggling, if you're talking to an employer, then maybe what you've done is you've cut through and you've raised the awareness to the level that they feel compelled to engage with their company. to help reduce stigma?
I think you mentioned something really important, which is when people are ready, engaging people when they're ready and offering those and providing those opportunities for people at different points in their journey that when they're ready, and that's kind of the core of the harm reduction approach, but it is through platforms, it's through media, it's through other aspects. It is literally a harm reduction approach to be available when people are ready for that, so that's so critical. You know, I've seen that as in practice, so many of my patients that, you know, when they come back and they say, I'm ready, that's a whole different ball game, as opposed to we pushing them to do something, which has some effect, but not the effect. You know, Ben, when I found, sort of saw that your organization was certified B Corp, I was like, what's certified B Corp? So perhaps you can tell us and how your business influences others to do the right thing, but also what is that?
Absolutely. So being a certified B Corp means that we believe that our business should be used as a force for good, and that we exist to provide benefit and not harm the things that we come in contact with over the long term. And that means that everything we do as a company needs to think about its effect on our employees, our communities, the planet, and shareholders. But all of them need to be considered. So as we think about recovery, right, we're a people-first company, and you hear that a lot. For us, it's not notional. People first means always, on everything, people come first. So, you know, we're also imperfect, right? You know, if someone had the courage to ask us, you know, several years ago, you know, we're doing all this work on substance use disorder, but what are we doing for our own employees? Do our employees know what benefits exist? How are we supporting them? Is it a safe environment for them? And I'll give you two examples to give you kind of a state of affairs for our organization back then. In the handbook, you could find a section on substance misuse and what the potential penalties for that would be. And one of the biggest ways we got together as an organization to celebrate things was company happy hours. Those are two data elements of how things were. And so when you sit back and you say, are we walking the talk? Are we doing everything organizational, align our actions with what we care about? We weren't. But you know, the beautiful thing about people and about our company is we're not fixed. We can improve, we can change. So we set out to create a workforce-supported recovery program that we were proud of, and we are completely different on the topic now. We have a handbook specifically for supporting recovery in the workplace. Every employee has it. We talk about it at our all hands. Our leaders are trained on it. We have panels that we do with people in recovery from the community and the company, talking about it, celebrating it. And those things, that handbook in and of itself has to accept the reality that people have many different paths, right? So we're like, here's what you need to do if you want to talk to your supervisor, if you want to talk to HR, if you want to talk to EAP. Here's how your information is, who gets what information and when. People are very concerned about that, right? Explicitly and explicitly, substance misuse does not result in termination. Explicit. People are worried about these things. They need to know exactly where you stand organizationally. And so those are the things we're doing to create an environment whereby we can encourage, make it safe, have confidence that folks can come forward and get proactively the help they need, and which can be life-altering.
Absolutely. So proud. That clap was for your energy. You know, one thing that I want to ask everybody, and we'll start with Sarah, is the challenge question. What one challenge that you all have faced, it could be more than one, as you work towards a recovery-friendly workplace, and what does it look like, and what it could look like for others? Because I'm sure there are employers here and online and elsewhere that are going to say, well, geez, I'd love to do that, but I'm not sure I'm like them, or I can get this done.
Sure. So the biggest challenge, frankly, is the stigma and the concern that putting efforts into this is not going to work. And that reveals itself in a lot of different ways. That can be, oh, that employee's a problem, let's terminate, let's push the problem away. What we often had to do, if you didn't already have an employer who had some sort of recognition that this actually is a safety initiative, and that's how it was authorized by Congress, by the way, as a safety initiative. But if they're not already attuned to that, we had to really make the argument about why this was good for the company's bottom line. And the fact of the matter is that once we got the flight attendant drug and alcohol program up and running, we were able to actually quantify the fact that 90% of that employee's time was put back into the workplace. And not only was it put back into the workplace, but they had a better connection to their safety duties. They were more connected to their peers and to management and responsive, and there was more presenteeism, there was a greater, they were doing a better job at work, and they were better employees. They were dedicated, and they could also then provide support to others. And they could provide not only empathy, but real response in other ways, too. We're caring for the entire public. So they were better prepared to care for the people who are on our planes. But we had to make these arguments many times in order to get employers to the point of engaging in the program, believing, taking that leap of faith, that they can actually engage in this and get a good return on that, making that argument to them, and then moving them to the second phase of let's make sure that it's not just straight to terminate. Let's talk about second chance agreements and make sure that there's a pathway there for the people. And then it's the employees who are making that choice, but they have that choice to make. And that has been a major return. And in fact, we've been able to quantify that is $780 a week back in the employer's pockets and back in the employees' pockets, because they are able to work and the employer is able to get that time rather than to have to train someone else, bring someone else on, and they've got a better employee. So that challenge actually also became something that we were able to quantify and talk about and share with the rest of the community why this program works, why people should lift it up, and why it is beneficial to the entire community.
Thank you. For those listening, obviously, $780 a week. I mean, these are some actual numbers, actual dollars that you save, and the cost of hiring new people is obviously way more than retaining the ones you have. So thank you for sharing that. I'll just turn over to the other members of the panel and just same question. What's the biggest challenge you've been facing, or multiple challenges?
So I think when I mentioned it was a journey, and so I think one of the challenges when we look at our workforce is not created equal. Not only are they geographically in different locations, and therefore you're dealing with different rules and various aspects of state differences, but we do most of our predominant work for the federal government. So even if we tell our employees that we are a recovery-ready workforce, they are working on contracts for the federal government on federal government sites. And so as the government goes on their journey, we need to walk this together.
We hear you. We hear you loud and clear.
Well, you know, because it's very easy for me to say, you know, you won't be terminated, but...
Right. Yeah. Yeah.
Well, and now we're at the White House. So, but yeah. So, but it is something that, you know, for anyone who's starting on this journey, don't feel like you have to tackle the entire thing at once, right? There are pieces and things that you can do that can just make it easier and can tap into this amazing talent that we heard from earlier, because these are individuals that will have great futures. So we'll be on the journey together, Dr. Gupta.
No, absolutely it is. And I promise you we're working on that too. So great. There's challenges, yeah.
I think the challenge that Liz talked about a little bit is that for us, we own and operate in 160 different markets, and every state, every community, every market is going through a different probably stage or have different challenges as it relates to SUD and recovery. And so it's having a policy that is consistent, but also realizing that you have groups that are going through different challenges across the country, and you have to address them individually, almost like, I can't remember who it was that started at the beginning, said, hey, no to people are going through the same thing. And so for us, it's identifying that it's very different for our group in West Virginia than it is for maybe a group that we have in Seattle. So.
Great.
Okay, Dr. Gupta, I can't give another challenge, but I can give something that I think is a data point that will help us as we all encounter some of these challenges in the workforce or perceived challenges. So I mentioned we're a research-first company. So when we go out to listen to figure out the dynamics of work recovery in the workplace, you don't ask the employers, right? You ask the employees. So we talked to 2,300 employees about recovery in their workplace. And there's some things we learned. They told us loud and clear, the workforce is recovery ready, okay? They can define recovery in their own terms, 90% of them, okay? They don't stigmatize their coworkers. Almost 80% indicated they would have the same or more positive view of an employee upon learning that they're in recovery, okay? But they have no idea what resources, what benefits are available to them. Only 11% know that their employer covers SUD treatment. Only 20% knows that they have paid leave. They can tell you, however, the exact things that they need. They want flexibility, they want paid leave, they want SUD treatment, and they want confidence that if they get support, that their job isn't going to be negatively affected and they're still going to have a job. So it's a different challenge than maybe you think. The answer often is communicate, 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 and then one more time communicate. Thank you.
That's so true. And look, you're doing it today. You look, tight labor market, this is why it's part of the economic figure here. And we have so many people both suffering from addiction but also in recovery. And that adds at a time when we have the lowest birth rate on record in history in this country and life expectancy going down. This is an important piece of not just national security and public health, but also economic prosperity. This becomes a solution for. So appreciate that. What we want to do is we have just a few minutes left. I want to ask everybody a question, then maybe follow that up with closing comments for everyone. The question here is, literally the last question, where do you see from 5 years from now your company and the country when it comes to building a recovery-ready nation and having a recovery-ready workforce? We can start anywhere you like.
I know. I'll go ahead and start. First of all, the fact that you gave us 5 years to solve the problem is good. Like, that's good. It wasn't 5 months, but I think it all starts, and I'm going to be a little bit redundant, but it starts with there being a conversation that people are comfortable having. And once you can have a comfortable conversation, and then I think the solutions come much faster. So for us, it's recognition for employers and for the general public that this is not a taboo topic. This is a topic that should be addressed, and once we do that, then I think the solutions could come very fast.
And you see other media partners also, like other media companies take this up as well?
Yes, I do.
Great.
You're right, it's a tough one. So building on that, thinking about 5 years out from now, it would be wonderful to think that that all of us will have been on enough of a journey, and there will be enough awareness that it is mothers, brothers, sisters, colleagues that are all in this fight together, and that the stigma has been completely removed, which would make it such that we're able to meet people where they're at. And so certainly as a company, I think we will have the platforms and the capabilities needed to be able to be that recovery-ready workplace, and certainly sooner than hopefully 5 years. But I do think because there is so much awareness on the federal government side, really having that evolve faster. There were definitely policies that were in place many, many years ago that have evolved over time related to clearances. And so I think that that's something that I think we could really move forward, which would be fantastic for our industry.
Absolutely.
I think we're all in on this topic, not just because it's the right thing to do, but it's a business imperative for us, right? Our business succeeds to the extent that we can attract an employee base that reflects every part of this company, and they can have an environment where they can thrive, where they feel safe to do the amazing and to trip and fall and get back up again and have help in that where they need it. And, you know, we're not going to choose. No one's going to choose, right? You can't create that environment if you're saying, well, we'll lift you up on this issue. We're all in it. And this other one, yeah, cast you aside or step on you as we go by. That's not how we intend to operate. And so creating that environment, that's a business imperative for us. And I think that's the direction we all should be going, where we all have a lot of challenges and things we're trying to overcome throughout life, and we need to be supportive of one another through all that. And this is one, but it should be, you know, you're getting support for chronic disease, you're getting mental help, whatever it is, it doesn't matter. You got to be there for one another, and that's the only way we create that environment organizationally is holistically.
So we have 350 FDAP peers trained at 24 different airlines to support their peers. I think continuing to build this program and having that direct support right in the workplace is very important. But this issue also can't be siloed in any way. So this issue is on the UAW picket line right now, where the workers are fighting to get rid of tiers so that they can all provide for their families and so that they can have a secure retirement and so that they can have the flexibility to be able to get care and they can make use of that. It's on the Writers Guild and SAG picket line as well. It's across the country with people fighting to make sure that this is a place where we can lift each other up rather than tear each other apart. So the entire conversation about who we want to be, and Ben, would you please come to our conference next year? We really need to recognize that this is integrated into all of our communities, all of our workspaces. It is about whether we are safe or we are not. It is about whether or not we can care for our families. It is also about recognizing that this isn't just the worker, that the worker actually comes from a community and a family where they have to feel that support too. So we have to look at this very holistically, and I am just hopeful that we're going to continue to talk like this, that more of us are going to be talking like this, and that this is integrated into our politics, and it is also in the implementation of our politics. All of the wonderful bills that have been passed since President Biden has been in office, and also fully implementing the Mental Health Parity Act, finally. So that's where I'd like to see us.
Thank you, Sarah. Thank you. That's a priority for us too here at the White House, so appreciate that. Let's do this. We've got a couple of minutes remaining. Maybe we could quickly go and provide some last thoughts before we wrap up this panel.
Well, first of all, thanks again for having me part of this. This has been, it certainly was very inspiring to hear the panel before us and know that there is a bright future. So even when I think about 5 years from now, it would be really great to think that this is less of an issue 5 years from now, and not the recovery-ready workplace, but the need for the recovery-ready workplace. So certainly the young people in the audience, you know, feel lifted up and know that you have others that you can reach out to try to help so that this is less of a situation in the future. And I'm looking forward to that bright future because you are really bright, wonderful individuals. Thank you.
I would just say that no big change comes easy. And so if you want to have change, it requires people that are very passionate, like the people that I'm surrounded by up here, and that are deliberate in their intentions and their commitment to have change. And so back to your question earlier about can this happen in 5 years, as long as there are leaders that will stand up and say this is important and make a statement and then commit, knowing that it's not going to come easy, then it can definitely happen within that time period.
I guess maybe two quick thoughts. One is just gratitude. I mean, I feel like I'm here, but there are people in this room, a lot of them, that maybe have an even stronger voice to add and that have done a lot more for a lot longer. I'm grateful to be here, but understand my place in it, which is small compared to a lot of you. And then second, collective action, I guess. I mean, if anyone wants to work on this together, because together we are so much stronger, to your point, I'm here. Let's go. Let's go. We're doing research. We're putting out products. Let's work together to bring them to action, because these words, they do something, but action is what matters, period.
I'm inspired with our youth here, and as I think about my life, and I'm going to get a little choked up here, but some of the people who have been the greatest mentors to me, who have given me the greatest vision, who have provided solution-oriented responses, have been people who are in recovery. And so I want to actually also really thank the recovery community and applaud the recovery community, because this is where solutions live. Thank you.
Well, we appreciate our panel so much. It is a rich discussion and a conversation and a call to action moving forward. So thank you. Let's get a last round of applause to our panel. Those were some, really wonderful, informational, but also inspiring panels. And thank you once again, all of you, for staying engaged. Now, it is my pleasure to introduce our next speaker, Joseph Green. Joseph is a spoken word artist, educator, and motivational speaker. And he's here to perform for us today. I've met Joseph a couple of times before, most recently 3 weeks ago on Overdose Awareness Day. Joseph is a person in recovery, and he has also lost someone close to him to overdose. So please join me in welcoming Joseph Green.
How's everybody feeling? That's good. We've been sitting still for a while. I'm going to give you a gift. I'm going to give you the first 30 seconds of my presentation to stand up if you are able, and just stretch out and move a little bit, crack your back. I don't want anybody in pain while I'm up here telling my story. You move around. You don't have to leave. You have to do your favorite stretch, whatever it is, and then sit back down. I realize we're in the White House, but it's time. It's okay. Put that down so it's not in the. Yep. Thank you. My name is Joseph Green. I am the son of Henry and Helen Green. I am the father of Henry and August Green. I am the partner of Angelique Green. I am a narrative disruptor. I am an active member of my community. I am a professional storyteller, and I am capable and able to be all of those things because I am also a person in long-term recovery. I am going to do a poem for you all in a moment, but before I'm going to start with the story to sort of just kind of set it up. I've had the pleasure over the last couple of months to work with SAMHSA, CSAP, and a bunch of amazing storytellers from across the country to put together an event we call Disrupting the Narrative. This week, we've also been doing an event called Mobilize Recovery. It is an amazing event that I'm honored to have been a part of and continue to be a part of. And at this event, we took this prevention storytelling competition and we married it with recovery. And what we realized was that at the center of all of the things that we're doing to try to make the world a better place, that our values are the same. That we are all trying to instill wellness. We are all trying to be the best versions of ourselves, and we are all trying to make sure that the next generation doesn't deal with the same issues that we are dealing with right now. And so, as a storyteller, I've always kind of felt outside in rooms like this because it's policy and law, and there's a lot of gray and navy blue suits, of which I own none. And I think that it is beyond time for us to start connecting all of the hard work that these organizations have been doing with all of the real stories that happen every day out in the world. Because for every story that we told on the stage at Mobilize Recovery, there are social determinants that directly affect what happened to those young people and what we can do to make sure it doesn't have to happen again, right? Or doesn't happen again. And so I think it's vitally important that the narrative and the statistic, the narrative and the scientific find a way to come together because the numbers are real, but the lives that are behind those numbers are even more real. And they're the things that motivate us to do the work that we do, and it's the reason why we know there needs to be a change. When I was a young man, I went to middle school. How many of you went to middle school? Okay, cool. I went to a dance at middle school. I don't know if any of you have ever been to a middle school dance, and I don't know if things have changed since when I was in middle school, but if you took this as the cafetorium that it was in, up here would be where the food was and the DJ. Over here would be bleachers, and all the young men were sitting on the bleachers, and over here all the young ladies were standing against the wall, and the teachers were somewhere around questioning their life decisions. Why are they chaperoning a middle school dance on a Friday night? But no one was on the dance floor. And so it may be hard for you to believe, as fly as I am right now, that back in middle school, I didn't look like this. Well, my head was this size, but my body was more like this. So if you wanted to know which way the wind was blowing, just put me outside. But I was close friends with one of the most popular girls in the school. And she wanted to dance. So she looked at me, and I looked at her. And in that moment, I don't know if you've ever looked directly in the eyes of someone who has like a gravitational pull about their personality. But in that gaze, I forgot some very important things about myself. The first thing I forgot is that I could not dance. And that I did not have the self-esteem to withstand what was most likely to happen if I walked out into the middle of the dance floor. But she was there and I was there, and for about 2.5 minutes, I was living my best life, having a great time, and like in a movie, I saw something out of the corner of my eye. Someone was smiling and giggling, and I said, there's no way they're laughing at me. And then I looked out the other side of my eye, and there's someone smiling and giggling. Then all the teachers apparently came back into the room, and they're all smiling and laughing. And I realized in that moment that everyone is smiling and laughing at me. And I am mortified. And in 80s movie montage fashion, I run out of the double doors, never to dance in public again, for at least 10 years. Now, when I tell this story to young people and I travel around the country, many of them have a look on their face at this point like, is this the worst thing that ever happened to you? And no, it is not the worst thing that ever happened to me. But it is when I can remember in my story beginning to care more about what other people had to say about my happiness and what made me happy than I cared about my own voice inside of myself, inside of my mind. The voice of the people that have raised me, that had showed me what it meant to be me. I started to push their voices out, and I only cared about everybody else. Fast forward 10 years, and I'm in college for theater, surprise. And we go out to a nightclub, And at this nightclub, the DJ knows us. They play a set of music that is just for us. And we get around in a circle. And what's special about this circle is that everything that happens inside of this circle is sacred, right? The only rules for being inside this circle is that you have to be your true and authentic self. It doesn't matter if you can dance, it doesn't matter what size you are, it doesn't matter what color you are, how much money your parents make, or what you're going through right now. We want you to move, because in that movement, there was freedom. But what really was happening, I was learning that you can build circles of support, choose your family, and find people that will accept you as you actually are. And it's a beautiful lesson to learn. And it's a value that I hold today. Unfortunately, what was wrong with that space is that that particular circle was fueled by drugs and alcohol. The people in that circle had problems, myself included, and we had never been given the tools to deal with those problems. And so people think of drugs and alcohol as the problem, but in this particular case, we were using it as a solution, and that solution obviously begins to cause you more and more problems. Fast forward 10 years, I've lost some of the friends in that circle. I've been traveling, trying to put together that support system again, and I find myself, ironically, in another circle, only this one's in the basement of a church. And I'm sitting to my left and to my right. Every time I turn and say I'm going through something, the solution isn't to pick up a drug or an alcohol, it's to talk about it. It's to take a step. It's to seek help. It's to turn inward and take inventory. It's important for us to find these spaces of support. It's important for us to understand that we can create community and choose family, but it's also important for us to be given the tools as far upstream as possible to deal with the inevitable storm that is human condition and life. And so this directly leads into the work that I do. I've been, for the last 15 years, going out of my way to try to create spaces for those without rhythm and those who don't feel like they belong anywhere, to be able to share, find family, and ultimately walk away with tools that are going to allow them to be the best versions of themselves. And so all of that has led me to this place, and to share that little story with you, but also to point that out as an example. I know that the people in this room care about equipping Americans, humans, with the proper tools to be the best versions of ourselves. Because whether or not you are here dealing with a problem that puts you into recovery or not, we are all recovering from something. We are all facing a battle somehow. And the things that we can share with our family members and our communities are not just going to make our jobs better, not just going to make our schools better, but it's going to make our world better. So I'm honored to be here. I thank you so very much for the invitation to share this story and now this small poem I wrote so many years ago and have been editing over and over again. The first time I had the opportunity to do this poem with the music that you're about to hear was at Mobilize Recovery in Las Vegas. And the poem is called Dear Me, and it's for anyone who needs to have a conversation with the me that's inside and to say, hey, I know it's rough. I know we've been through a lot, but look at where we are now. We've made it, and there's so much that we can learn from our journey. So this poem is one of reflection. I hope you enjoy it. And if you want to know more about me or this poem, you can hit me up. I'll be hanging out there being like, hey, I'm in the White House. Someone shake my hand. I don't have business cards because the pandemic, but you know, my name is Joseph Green. You'll find me. And with that, young man, thank you. In a dream, I saw the adolescent version of myself leaning against the wall at a middle school dance. Appearing nervous, with our head down, he seemed wanting, if not needing, of some advice. I pulled out a napkin, composed a letter, a literal self-help manual, slipped it into my own prepubescent hand, looked down and read, Dear Me, Dance. though you will not be good at it until your early 20s. Bear witness to how solar systems are created within the orbits of thighs. As you two-step through universe, do not forget to breathe. If she approaches, it was meant to be. If not, Big Dipper or supernova. You will discover painfully that the wonder behind dancing is a lot like love. It is not solely predicated on the idea that you will always have another there to do it with you. You will often find that you are doing dancing and loving alone. But young man, don't you dare stop. Dear me, or future phoenix rising, the best friend an imaginary turtle could have. Your imagination is stardust, the stuff of fantasy and fairy tales. Careful, do not get lost in the clouds or blown away by the storm of indecision. There is gravity in your dreams, forces felt but rarely seen, like purpose or faith. Allow only the truth to propel you. The forest is thick, wrought with distraction and danger. Hone your instincts. Even after they betrayed you, our wits, like the blade, are only sharpened through use. Dear me, or future phoenix rising, addiction and abuse are hidden within the strands of your DNA. For you, there's no such thing as trying drugs. You were never raised having been taught how to heal while giving in to the pain, only how to mask it or avoid it or dump it at the feet of the people who have loved you most. Abusing substances was never the problem, only the wrong solution. A poisonous solution that will strip your branches bare, causing you to lose things, most of which the universe will never see fit to give you second chance with, all of which will break your mother's heart. Dear me, a would-be knight in shining armor, the people labeled broken on arrival cannot be saved, merely loved and accepted, as you will one day hope to be. Joseph, put down the blades, lower the heat in the shower. Pins are not tourniquets, paper a poor Band-Aid. It will be years before poetry will send words to save you. Stop it now. Your soul will heal long before those scars do. Dear four-eyed oracle, some wounds won't heal magically with mother's kiss. Won't make sense for years to come. If I could actually give you life and a manuscript, the instructions would simply read, only change the parts where you hurt people. Everything else is miracle. Besides, what's the worst that could happen? You grow up to be me, a shattered but mending, sometimes unemployed, literary freestyle specialist with a vampire's thirst for the universe's lifeblood. And young man, I have loved you all along. Sincerely, Joseph LMS Green. I hope the music wasn't too loud. To the young people in the audience, before I leave, thank you. I know that you've been provided tools, but it is your hope, your ability to look at all of the things that have happened to you and decide that you still are going to try, that you are still going to put one foot in front of the other and know that life is going to give you something back worth living. It is that hope that is inspiring all the other people in this room to continue doing the work that we're doing. But most importantly, know that without your voice, this conversation is one-sided. So please continue showing up at these events, continue cultivating your story so that people can hear it and be able to make policy and changes based on your stories until you are here one day in this row inviting other people to come in and share their stories. Thank you.
Wasn't that amazing? Thank you, Joseph Green. Appreciate it. Another round of applause. Now, let me introduce our next speaker who just rushed over here after votes in the House so he could be a part of this celebration. Congressman Paul Tonko has been a real champion for change in Congress when it comes to supporting treatment and recovery for all Americans with substance use disorder, especially people with opioid use disorder. Now, he was a person behind the force behind the sponsoring of the MAD Act, which President Biden signed into law in December, and this law expanded treatment for OUD like never before. He's been a strong advocate for providing treatment in carceral settings and during reentry. And he's been a friend and a partner in our efforts to beat the opioid crisis. So please join me in welcoming Congressman Tonko.
Thank you, Dr. Gupta. And thank you, Joseph Green. Powerful message, powerful message. And thank you, my heroes, for the opportunity to present here this afternoon. We just got off the House floor, and you are such an engaged community and such an inspiration. And I constantly refer to you as my heroes because I can't imagine the courage and the determination and the strength and the resilience that are part of your being. So good to be with all of you and all of the leaders in government that make efforts and responses to the illness of addiction possible. Thank you for having me. I'm energized to be here with the recovery community, a community whose strength knows no bounds. This past August district work period, I was honored to spend a good deal of time in my district with our recovery community. It's the capital region of New York, the New York 20 seat. Over the last few weeks, I attended an overdose awareness vigil, participated in 2 naloxone trainings in my district, and 1 on Capitol Hill. I visited 2 methadone clinics, visited New Choices Recovery Center, had a harm reduction conversation with Project SafePoint, and I met with the New York State Coalition to Prevent Addiction and Support Recovery in Employment, known as PARS. And with those visits, I barely touched the tip of the iceberg of how our local recovery community is making a difference, saving lives and living meaningful lives in recovery. While the recovery community brings great strength, and I hope that is a focus of today, I also want to discuss the reality we have that we are losing too many of our loved ones to overdoses. You know, the words crisis and epidemic get thrown around a lot when it comes to describing what's going on with overdose deaths in our country, and I couldn't agree more. When we're losing more than 110,000 of our loved ones, our friends and our neighbors, to the devastating disease of addiction, I'm not sure what else we could call it. But despite paying lip service to this epidemic that has swept the country and providing some good first steps, Congress has, in my opinion, not responded with the fullest measure of boldness that is needed to really turn the tide. If we're going to say crisis, if we're going to say epidemic, let us act accordingly. Please, let us act accordingly. We have to demand better. This disease of despair deserves a response deeply rooted in hope. That's why I've focused my advocacy in Congress on knocking out every single barrier to addiction treatment so that when an individual struggling with addiction reaches out for help, when they have that moment of clarity, we have a medical system ready to welcome them with open arms. Service on demand. In Congress, I proudly led the Addiction Treatment and Recovery Caucus over the last couple of years and worked to reduce stigma and improve access to treatment. Patients struggling with the disease of addiction would be better served by a healthcare system that, by word and by deed, really does treat addiction and mental illnesses like other diseases, and not one that makes providers jump through special hoops just to treat their patients. That's why I introduced the Mainstreaming Addiction Treatment Act, which last year was finally signed into law. This eliminates the outmoded barriers that prevent more people in need from having access to buprenorphine and other medications that are life-saving drugs for addiction treatment. By passing this law, and thank you, President Biden, for signing it, We are vastly expanding access to addiction medicine and move us closer to a system of a treatment on demand for those struggling with addiction. I'm also working to make certain that those who interact with our criminal justice system, which is often related to an underlying addiction, have a clear path, a very clear path, to recovery as well. Many individuals in our nation's jails and prisons are struggling with a substance use disorder, and many have co-occurring mental health conditions as well. Unfortunately, our current fragmented system of care causes many of these individuals to lose access to their health care benefits upon entering any incarceration center or jail or prison, even if they have not been charged with the crime or are simply awaiting trial. A gross injustice. In practice, this can lead to significant hurdles in accessing care, as the process of restarting benefits post-incarceration can indeed be bureaucratic and time-consuming, leading individuals to go without mental health or substance use treatment for weeks while they wait. We know that these delays in care can be deadly, as individuals leaving an incarceration setting are 129 times more likely to have a drug overdose in their first 2 weeks post-incarceration than the general public. So I've introduced the Reentry Act, common sense legislation, which would allow states to restart an individual's Medicaid benefits 30 days prior to release, so that we can truly improve continuity of care during this fragile period and provide a funding stream so that more correctional settings can offer high-quality mental health and addiction services, improving quality of care and reducing recidivism. It's really a win-win outcome. As we consider the SUPPORT Act reauthorization, let me share clearly that there are some good policies we're moving forward in it. I'm pleased that in the House, we included my Extending Access to Addiction Treatment Act. As many of you know, medication-assisted treatment for addiction significantly reduces the risk of overdose deaths. However, despite the effectiveness, approximately 87% of individuals with opioid use disorder who may benefit from life-saving medication-assisted treatment simply do not receive it. My Extending Access to Addiction Treatment Act makes permanent the requirement that Medicaid provide coverage for addiction medication for Americans who need it. It's a resource that is a life-saving resource. I also think we are taking a step in the right direction by requiring states to suspend rather than terminate coverage of Medicaid for justice-involved individuals, making it easier to restart those benefits upon release. However, this package falls far short of taking what I believe are the necessary steps to address the deep need of this crisis. We all know the scale of the devastating disease of addiction. We know the human cost of inaction. To be precise, it's the 109,680 lives that we lost last year. For each of those individuals, there's a whole universe of friends, of family, of communities impacted. Let me leave you with this. The only way to attack a crisis of this magnitude is to respond with boldness. Working together in a bold fashion, we can ensure that no more lives are senselessly lost to this devastating disease. For those living a life in recovery, I deeply congratulate you, and I hope your example will inspire others to see that a life in recovery is full of hope and possibility, that you are a functioning individual living with addiction as an illness. That is an important statement. You make a bold statement. Before I close, I want to thank Emily Silverberg, who's with me today, who's been part of this legislative journey. I thank you, Emily, for all the work done to make certain that we can deliver on your behalf in the House of Representatives. And let's make this a high priority. Our budget, our legislative agenda is a statement of our values, our priorities in government. And if this isn't a priority, then we need to work on those who just don't get it. So for your boldness, I say welcome. For your boldness, I say thank you. And Dr. Gupta, Dr. Delphin Rittman, Thank you for your focus and your commitment to the recovery community. And thank you, everyone here, for the entire recovery community that you are, for the enormous strength that you bring to this equation of success. You indeed are inspiration and, again, role models of heroes to me. It can't be easy, but God bless you and congratulations on your journey and your success in recovery. Thank you so much.
Thank you, Representative Tonko. Let's give another round of applause to Mr. Thomas. And thank you to everyone who's joined the Celebration Recovery today, here and online. As I said before, people in recovery are the backbone of this economy and are helping us build a stronger nation. You heard it from me, you heard it from Senator Shaheen, Congressman Tonko, Assistant Secretary Delphin Rittman, and you heard it from our panelists today. And I'm thrilled to see that we have such important employers working to build recovery-ready workplaces. And I'm so glad that we have young people in recovery who are going to be entering the workforce of the future and making it even stronger. And everyone on their journey to recovery, I want you to know that President Biden and Vice President Harris have your back. As President Biden said in his Recovery Month proclamation, quote, "We recommit to making sure that every American has access to the services and support they need to rebuild life of purpose and hope," close quote. So thank you, everyone watching here and online, and for those of you in the room that we're going to make sure that we can make our way down to the steps from pictures. Thank you to our staff as well to making this happen today. So thank you and have a wonderful National Recovery Month.